CataractCoach.com, learning with the HelpMeSee Eye Surgery Simulator. Learning and practicing directly results in great surgical skills. This video is sponsored by HelpMeSee.org. Now you can see all the surgical simulators for the HelpMeSee simulation-based training program. These are amazing devices that are true virtual reality simulators for all types of eye surgery. But let's focus on the most important issue right now, and that's global cataract blindness. Remember, the problem is not a technology problem, it's a training capacity problem. We're not just training enough surgeons. As you know, the World Health Organization reported that global cataract surgery coverage is not on track to meet the World Health Assembly goal of increasing it by 30% by 2030. We're just not there. And it's largely because we're not preparing surgeons in areas such as Africa. To succeed with this challenge requires expanding surgical education while maintaining patient safety through competency-based medical education. You're going to progress not just based on the time logged, but actual demonstrated proficiency in these surgical procedures. And that's the key differentiator. Simulation-based training allows surgeons to practice extensively and then meet these objective skill benchmarks before operating on patients. And that's amazing. To support this effort, HelpMeSee is going to begin with expanding its next-generation simulation-based training systems in 2026, starting with pilot sites and then expanding all across Africa, including Madagascar, Ghana, Gambia, Tanzania, Nigeria. In addition to its current MSICS, phacoemulsification, and complications courses, HelpMeSee is launching a new comprehensive MSICS program. That's manual small incision cataract surgery. And it's going to be a 3-phase training module that covers the entire full spectrum teaching of the care, from the patient screening, then to the very important surgical treatment, and then, of course, the post-operative follow-up. So let's show you an example here of using the simulator to do an incision for MSICS, which is arguably the most crucial part. So here you can use the instruments under the simulator to make there's your M6 incision beautiful. Well, how do you know it's good? Well, the machine measures all the metrics for you. So it's not just subjective, it's truly objective. So you can see there's the scleral groove, and now when it analyzes your performance, you can say, look, you did a great job. Everything is good, the length, the groove, and you got a 20 out of 20 score. Now here, translating that to the real world, you can see the surgeon's doing the same technique here. So what you learned on the surgical simulator, and you passed the exam there, you showed proficiency, now you apply the same thing to the actual patient, and you've got a much better result. This is truly the next generation of learning, and I think all surgical learning should be incorporating these types of devices in the future. So you can see, as we know, in the M6 cases, the incision is by far the most important part of the case, because that determines how well the eye closes at the end of the case, it determines the astigmatic effect, it determines whether or not you'll have iris prolapse, and all these metrics are measured as you practice on the machine here. So you can see now you've got a beautiful done scleral groove there, you've got a good tunnel length, you've got appropriate funnel-shaped M6 incision. This is done right, and that looks great. So again, direct translation, what you do on the machine applies to the patient. Let's look at another example here. Here now, let's talk about nucleus delivery, one of the hard steps of surgery as well. You've got to deliver this nucleus out. So again, surgical simulator, the top right corner shows the hands and the instruments being used, and then here we go with a lens loop and bring it out of the eye and not scraping the endothelium. Ooh, that looks great. And now let's examine the results here. When you do the analysis, look at that. You did a beautiful job. Nucleus removed, endothelium was not touched. You didn't pull on the iris. You got a 15 out of 15 score. Fantastic job there. So again, using this device, you can really practice over and over again to get the subtleties of the motion correct. And again, take the nucleus out. Looks great. You did a beautiful job through the simulator. And the simulator is measuring you and giving you a performance metric. And you can do this as many times as you like to know to become very, very competent. Again, grabbing the 2 instruments here, good control, go under the nucleus, slowly bring it out. Beautiful. No iris prolapse, did not touch the endothelium of the cornea. Again, we can get an exam here, and the competency says, beautiful job here. 15 out of 15, you did everything correct. That's how it works. Now, let's translate that to the real world. Here's an example again of a real patient. And the surgeon's already practiced on the simulator, and now we're going inside here, putting some viscoelastic, and we're going to do the same thing with the nucleus delivery. As you know, this is a very tricky maneuver. You don't want to scrape the endothelium with that cornea. right? And you don't want that nucleus to also damage the iris. So you want to avoid those issues, and look at that, a beautiful result. Now just washing out some residual lens material there, and you can see no iris damage, no endothelial touch, beautiful delivery of that nucleus, keeping control the entire time. And that's directly as a result of practicing. That's the beauty in this surgery. Right? With this surgical simulator, you can really become proficient, demonstrated object proficiency prior to doing the actual patient surgery. Remember, competence should determine when a surgeon is ready to operate, not the time spent or logged or the number of cases you've done. Surgeons develop skills at different rates, so training systems have to measure proficiency, not just assume it. Simulation-based mastery learning allows surgeons to reach objective skill benchmarks before operating on patients. Objective assessment tools can measure surgical performance, such as instrument handling, error rates, procedural flow. And scaling cataract surgery globally requires training more surgeons while ensuring consistent competence and patient safety. The future of ophthalmic surgical learning certainly is a virtual reality simulator like this one from HelpMeSee.org. There's a link down below so you can try it for yourself at an upcoming meeting. Test drive the machine. See what you think. I bet you're going to love it. It'll make you into a better surgeon. This is how we train more surgeons for the future to satisfy growing global need.